negative for protein.
Medical assisting is a 2-semester program, and we train people how to work in the clinics with doctors and nurse practitioners and physician assistants. And we train them how to take care of patients. We also train them in the area of medical lab, insurance, and reception duties, and billing duties.
The first year, we're anywhere from learning how to change bandages to making sure we learn how to clean areas that are sterile for surgeries, and also just on how to communicate with the patients.
Second semester, they're going to be working with injections and patient teaching and doing ECGs. For the medical lab area, they're going to learn how to draw blood, so they're going to do phlebotomy, capillary punctures, and what we call wave tests, or simple tests like pregnancy tests and strep tests. They learn how to take the specimen, and then they also learn how to process the test.
We do a lot of hands-on procedures. We're doing throat cultures, wound dressing, wrapping instruments, learning how to assist the provider in a surgical procedure, all different kinds of stuff.
We do a lot of hands-on, so the students that come here, they have to anticipate that they will practice on each other, because when you get into the clinic setting, you're going to be working with patients and not mannequins. So we're firm believers of training students so that they can practice exactly how they're going to see it out there.
We get to do and see a lot of cool things that you don't really think about in your day-to-day life.
I really liked the microbiology stuff in lab because we got to do streaking plates, and I think the little tiny things that we get to learn about are exciting.
A lot of the hands-on stuff, the students helping each other, the instructors really helping you when you need it.
I really like the instructors. They're very friendly, they're very open, really knowledgeable about what they're teaching about, and I really like working with everybody else who's in the program, and it's a really exciting subject to learn about too.
I like that I have so many different options from this program.
There's a high need for medical assisting. We cannot put out enough medical assistants.
I would say you have a lot of options going through this program afterward, to work in an office, to work in the clinic, to work in a lab, wherever you want. And it's not an expensive program, so it's pretty manageable, and you can do it in 3 semesters.
For me, it's the whole transition of a student who comes in and really unsure of themselves, and their confidence is really low, and then all of a sudden in a very short period of time I see them blooming and they're getting in their job and they're excited, and then I see them in healthcare as my medical assistant.